There is a lot of saying in the health sciences about 3 aims for a good healthcare situation. And the first should be to improve the health of the total population. The second, to enhance the patient care experience so that patients really feel safe and comfortable inside the care system. And the third is to develop all this kind of healthcare improvement within an affordable way so that people and society can pay for it. And unfortunately, all these 3 aims in a lot of societies are not being achieved. I don't know so much like you about the Greek situation, but I think that there is a real big crisis you face at the moment. But as well in the other countries, in the developed countries, people feel unsafe in the healthcare system. People are not supported in their health improvement, but a lot of doctors work on them, but sometimes they work with the false methods, and sometimes they work more than it's not necessary and helpful, and then sometimes they work less than it's helpful. And the costs are rising in every country. So that was a little bit the question, how to work on this. And our idea was that healthcare is a local business. And now it comes again to your discussion about local initiatives. Healthcare is a local situation. And its health is being maintained on a local situation, not on a centralized governmental situation. And the question is, who could be responsible for this development of a local healthy situation? And is this the city municipality? I took the Athens logo for it. You might be a little bit unsecure whether a city is best in developing a good healthcare situation for you. The knowledge for healthcare maybe is not the best, and the quickness of being responsible towards the needs of a patient maybe is not the best as well. Then there are GPs or general practitioner or other doctors, but often they are very singularized. They work in a singular practice, and then they can't look for all the healthcare situation for one person. So, and maybe they have not enough organizing know-how, how to relate to the physical exercise necessities for a patient, or for the good chronic care management for this person, and so on. And if you look at hospitals, I managed a hospital for myself for several years. Often there is not enough public health interest in a hospital. A hospital is rewarded by developing procedures, having a big operational theater and working a lot on HIP and all these things that are needed in operations. So the public health improvement on chronic care is not so much a hospital business, it's more a primary care business, so that could be in some conflict. And the insurances, or here in Greek, the EOP, they often focus too much only on costs, but not so much on the health situation, or not in the investment in health. And so we think that a regional care company maybe could give a better answer. So like cooperative networks of physicians and others can take on responsibility for developing a good healthcare experience and a good health situation for the patients there. And then this regional care company could be owned partially by providers, maybe as well by the hospital or by the municipality, or by civil foundations or seniors organizations or patients advocates, sports clubs, all the civic associations that are existing in a neighborhood. a problem. If it's owned mainly by the providers, it could create an overload of services, again, because providers are tending to get their fees by as many services as they render. So that could create higher costs. The solution could be if this regional care company is being paid by the insurance for the achieved health outcome. So if this achieved health outcome can be related and adjusted to the normal costs of care, then it could develop an orientation, a business model on developing health. And it's not only a theoretical idea, we did it. And now I show it where we did it. Kinzigtal is a small valley, so maybe it's like an island, in your opinion. It's a small valley as part of the Black Forest in the very southwest of Germany. So the border comes near to France and Switzerland. And we had 4 very courageous partners in these times. In 2006 we began. We had a cooperative or a network, we call them Ärzte-Netzwerke, physician networks, where nearly 40% of the physicians of these regions came together and said, we should change our situation. We shouldn't stay with it as it is in the moment. That is called MQNK. And then I'm a pharmacist from my profession, but I'm working since 25 years in public health. So I was a health scientist in the University of Hamburg. And I built up a company oriented towards this kind of reorganizing healthcare. And so we joined forces and we developed a joint company that afterwards developed a contract with insurances. And so we took the one very big insurance, that is the insurance AOK. It won't say anything to you, but that's not necessary. It's the biggest one in Germany. And the farmers' insurance. So for the farm workers, for the wood workers, this is the insurance. And together they have about 45% of the population inside this area being covered by this insurance. And up to now around 60% of all the physicians and the specialists and the general practitioners of these regions are partners. And altogether we have about 500 people working with us in this effort of reorganizing the healthcare and the health status of this population to the best possible situation. And the important thing is that providers get their normal fee plus what they get from the insurances like any other provider in Germany, but they get a surplus fee from us, from this company, for specific targeted goals that we want to achieve. So, for instance, smoker cessation, or for instance, a good management of osteoporosis or of heart attacks and so on. It's a very lovely region, and you see on the right side a picture of one of these costumes, traditional costumes of this region. Yeah, I can go on. So we have now about these 500 people that are involved in this project, as well physicians, but as well hospitals, physiotherapists, nursing homes, the home care agencies, pharmacies, self-help groups of the patients, local enterprises, fitness centers, and so on. And just to give an impression for the numbers, the very small thing is the staff of Gesundes Kinzigtal. We have about 20 people working with us as staff, case managers, health promotion workers, social workers. Then we have about these 500 healthcare professionals working with us. Then we have about 10,000 members of Gesundes Kinzigtal that are our patients that have decided to be with us, to work with us, to to develop a new kind of healthcare inside this region. And then the total population, the insured, the 33,000, and the insured, 71,000. And we have 5 key success factors we could speak about: pushing medicine from reacting to acute symptoms to agreements between providers and patients about joint goals. Then the activation of patients and insureds and the healthcare professionals so that they really get into this idea how to improve health instead of only how many services we can render so that we can most get money. And then substituting too much medication. You know, I'm a pharmacist, but I'm not very fond of too much medication. Through physical training, there are a lot of studies in the last 10 years that have shown that physical training and exercises is much more helpful for a lot of health conditions than medication. And this scientific orientation that is part of it, and that we get the data from the insurances so that we can analyze what's happening, what are the problems, what are the gaps in care, and improving public health. It's now too long to go through all the activities we undertake. I just want to show only it's on activation, it's on integration, and it's going more and more into health improvement. So we go into the schools, into the companies, we develop health academy for training for people so that chronic care patients train other chronic care patients, and so on and so on. And I give the slides to the organizers here so that you can get the presentation if you like. And just to show that we already even achieved something. From 2006 to today, we achieved a better health outcome for the patient, and we did an evaluation taking the mortality rate. How many people died after they got member of Gesundes Kinzigtal? And we got the economic measure, how many costs arrived for these people taking part instead of those who are not taking part. And we took the change rate, how many people choose to leave this insurance fund. In Germany, every person can choose every insurance fund, so it's free. So the rate of those people who are leaving the insurance fund is a rate of unsatisfaction. And you see we get very good results in any case, matched with the control group and so on. So it's really a very intensive evaluation methodology that has been done. We have less costs for those who are part of the project, and less of them left the insurance, so that it's a higher satisfaction. So it's not easy. I don't want to say that it's just very easily to be done, but it's a very interesting effort and a very promising effort. The problem is that all over other parts of Germany, the normal system prevails, so that people are incentivized towards non-prevention, but delivering as many services as they could. So that's a problem for the providers to change their attitude. It's difficult in a different situation to do it. But a cooperative social business model is possible in healthcare. That was the idea we wanted to show. And it's a win situation for all three. It's a win situation for the society. We are attracting young physicians and nurses towards Kinzigtal. In some parts of Germany, we have problems to find doctors who are going into the rural areas. We are successful in this. We are keeping the people healthier. We are improving the workforce conditions for the local enterprises. If they have no healthcare there, then no more young people go to work for them. And for the insurance with the lower costs. A win for patients, getting better care, staying healthy, having more decision over their care. And the win for providers, getting surplus payment, from the health dividend I mentioned, and having positive feedback of healthier patients. The Heinrich Bell Stiftung, the Heinrich Bell Foundation, who is organizing this event a little bit with us, they had a health commission for Germany, for the reform for the healthcare in Germany, and they emphasized the orientation for all players towards health outcome, towards this kind of improving health, and suggesting creating social enterprise in this kind of way we do it in Kinzigtal. So the message for you to take home, this kind of, a new kind of contracting, a new kind of cooperative solutions inside a regional area is possible, and it's possible to gain really good results in health, but it's no free lunch. It's a lot of work that has to be done, but nevertheless it helps for all, and it raises joy and pride in the work. Thank you.